Hello, I am Jianbing Ma, Executive Managing Editor of Arthroplasty. While total hip arthroplasty is one of medicine's most successful surgeries for relieving pain, modern patients also care deeply about aspects like the surgical scar. Today, I'm highlighting a study that explores how a simple change in surgical technique can make a significant difference. This study focuses on the anterolateral supine, or ALS, approach for hip replacement. Traditionally, surgeons have used a longitudinal incision, as you see on the right. However, this cut often goes against the natural tension lines of the skin. An alternative is the transverse incision, shown on the left, which is designed to follow these lines. The central question is, does this change in direction actually lead to a better scar and higher patient satisfaction? To answer this, the authors conducted a retrospective study on 132 procedures, all performed by a single, highly experienced surgeon to ensure consistency. They compared the outcomes of patients who received the transverse incision with those who received the traditional longitudinal one. To measure the results objectively, they used a validated tool called the Patient Observer Scar Assessment Scale, or POSAS, which captures satisfaction, appearance, and sensory feedback. The findings are quite insightful. While a simple comparison of the raw scores showed no difference, a more sophisticated regression analysis, which adjusts for other factors, revealed the true impact. The use of a transverse incision was a significant predictor of both higher patient satisfaction and better scar appearance scores. This confirms the study's primary hypothesis. A common concern with any incision is the impact on skin sensation. Here, the study found no significant difference between the two incision types. As this graph shows, sensory scores improved over time for both groups. The most important factor for sensory recovery was simply the length of the follow-up period, not the direction of the cut. This is reassuring, as it suggests the cosmetic benefits do not come at a sensory cost. In conclusion, this study provides strong evidence that using transverse incisions in anterolateral supine hip arthroplasty can significantly improve cosmetic outcomes and patient satisfaction without a negative impact on skin sensation. This research is a valuable step towards more personalized surgical planning, where even small details like the incision direction are considered to enhance the overall patient experience. On behalf of the journal, I encourage you to read the full paper in Arthroplasty for all the details. Thank you for watching.